So, hi friends, I'm Dr.Anshul Bansal again joining you on this Unacademy platform. First of all, a very happy Diwali to all of you. Okay, so in today's session, we'll talk about INICET 2021 examination that is scheduled on 14th of November. Just 10 days are left. So we'll discuss some strategy and some tips and tricks and how your approach should be in the last 10 days. So थोड़ा ज्ञान वाला session रहेगा ये. Okay, so let's start this session, and before starting I will just briefly guide you about a various subscription plans available for the NEET PG on an academy. And usse pehle currently I am working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only. Okay, so a first subscription that is available for the NEET PG on an academy is your plus subscription. And in plus subscriptions, here you go. Okay, so in plus subscription you will have access to all the live as well as recorded classes, and you will have the access to the entire QBank, as well as you can participate in live quizzes and tests, all of which is found by the topmost faculty for the NEET PG in India. And also will allow the subscribers to subscribe to multiple devices with the same account, so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we will be shortly providing them with our printed notes. And while subscribing, you can use my code, that is AnshulB10, to get extra 10% off. The second one and the best subscription plan is the Iconic subscription. It is best not only on an academy but across any digital platform for the NEET PG in India. And what makes this best is that apart from the things that I've told you earlier, in Extreme you will get the prep ladder and all of the prep ladder, including its entire QBank, the video lectures, rapid revision courses, grand test, etc., everything. And on an academy Extreme you will get live well structured batch wise classes. Okay, so you can subscribe for this subscription and you can use my code, that is AnshulB10, to get extra 10% off. Special classes are very must, and you should always attend a special classes, because they will give you live classroom like feeling, as well as you can interact with your educators, and it will give you extra edge over your competitors. And also subscribe for QBank, because not only it contains 25,000 plus questions, but it have everything that is required for cracking any examination. Okay, the entire theory, recall questions, the image based questions, x-ray, CT, MRI, clinical based questions, instruments, everything is covered in a QBank. And we have also raised a new feature called as raise a hand feature, where you can just digitally tap on a button and you can raise your hand digitally, so that you can interact with your educators, and this will increase the communication on the digital platform. And also for the NEET PG 2022, we have started a batch dedicated to them, and also we have started a clinical case discussion and instruments batch, which is very important, because the things that you read theoretically, when you see them clinically, you will not forget them. It will be very beneficial to make your concepts and understand the topic, and also it will generate your interest. So please do subscribe for these courses. And this is a various subscription plans for the plus as well as the Iconic subscription, and you can choose any plan and use my code, that is AnshulB10, to get extra 10% off. And I would suggest to go for the plan with longer duration, because the cost per month decreases significantly. Okay, so let's start today's session. So सबसे पहले INICET is scheduled on 14th of November 2021, and it will be a online examination with 200 multiple choice questions between 9 a.m. to 12 p.m. 3 hours paper, 200 question, plus 1 for correct, and minus 0.33 or minus 1 by 3 for the incorrect. Okay, and remember 9 a.m. to 12 p.m. So those for the nocturnal students like me, I used to also study during night only. So get back your sleep cycle according to the examination timings. Okay, it will be a single best answer, but in INICET you have MCQs के अलावा you have the match the column type of questions. Match the column type of questions are very frequently asked, or sometimes they give you a long case and they ask 2 or 3 questions related to them. So it will be a single best answer paper. And as you all know, nowadays INICT or the NEET PG all are shifting towards the clinical based questions, the image based questions, the basic concepts that is required. So out of 200 questions, all 200 questions will be from the topics, or the questions will be like that you have read them sometime in your preparation phase. Okay, so कुछ भी हाई फाई चीज आजकल नहीं पूछी जाती है. Okay, especially the mug up वाली थिंग्स और दी थिंग्स जिसमें कॉन्सेप्ट नहीं, ओनली रट्टाफिकेशन होता था. ओके, सो please focus on these questions. You solve many types of question banks. Okay, but in question banks there are sometimes many questions that are so tough and irrelevant कि ऐसे क्वेश्चन नीट पीजी में और INICT में कभी नहीं आएंगे. Okay, so be smart while doing the question practice also. Okay, so if you read अच्छे से and you have done question practice for like, or you have given like 3 or 4 GTs, then you will come to know automatically कि yes, ये question मेरे important है and this question is not so important. Okay, so prepare smartly, this is very important. Okay, and image based questions, previous year paper में भी image based and clinical questions were very important. Okay, and now only direct questions make up around 10 to 15 questions max to max. Okay, and the year in which I had given that time AIMS PGI were all separate. So in my AIMS examination I don't remember that there was any direct question. All were very simple clinical based or image based, day to day normal MBBS student level ke questions. Okay, and as I've told you repeated time, key to crack any of these competitive examination, the key is question practice. Obviously पहले theory पढ़ के, but theory पढ़ना is one thing and to remember it is very important, and for that you need to revise. Revision is very important. And every time like orthopedics है, तो orthopedics का book लेके you don't have entire 2 days again to revise the entire subject. Okay, no, अगर आप ऐसे रिवीजन करोगे भी, so you'll forget them very easily. So uh, for the constant revision you should do the question practice, and the best way that I used to also follow that, like every day you get 10 to 15 minutes essay. So at that time I used to give the mini tests. Okay, like I had read orthopedics 1 month ago and I thought chalo aaj orthopedics से questions करते, तो I used to give like 30-40 questions का one mini test, and that would help me to revise the important topics and to know about कि yes, this topic is more important कि इसमें से बार बार questions आते हैं. Okay, so prepare smartly, and this is the best way to revise, especially in the last few days. Don't read the theory, don't change your source of the notes, etc. Do question practice, but very importantly do question practice वेरी स्मार्टली. ओनली रेलिवेंट क्वेश्चंस का लोड लेना है और किसी क्वेश्चंस का लोड नहीं लेना है. ओके, एंड कीवर्ड्स आइडेंटिफिकेशन इज वेरी इंपॉर्टेंट, स्पेशली इन द क्लिनिकल based questions. So clinical based questions may be whether photograph or x-ray is given or not, you should read the entire question first. Okay, and then see the photograph, then see all the 4 options, then take the option which is correct according to you. And ज़्यादा दिमाग नहीं लगाना है, एक MBBS स्टूडेंट के हिसाब से ही क्वेश्चन पूछते हैं. तो don't overthink or don't think too much hi-fi. the answer will be a very common disease most probably, okay, and with typical finding, okay. So this is very important. And so test ki practice, giving tests is very very important. And images in every subject, images are very very important, especially in the pathology, radio, PSM, microbiology, anatomy, and also orthopedics. So every hour image आप रट नहीं सकते, you cannot remember the images, okay. You have to store them in your subconscious mind, or you have to have a look frequently so that you will never forget that, okay. So the best thing about it, that I used to also while doing questions or revision, I used to take screenshots or the photographs of important images. I made a separate folder in my mobile phone, so every time when I was free, so like 5 minutes I used to scroll down 20-30 these photos and just see them and read something if it is written, that's it, okay. So at least you can spare this much time every day, 20 to 30 minutes, and you can look up to 70 to 80 photos daily, images daily. And this is the best way for the images, and a very high yielding thing also, because images देखने से not only you will remember that image, but also the relevant thing about that topic also, uska bhi you will have the continuous revision. So images के लिए सबसे बेस्ट टिप एंड ट्रिक यही है, ओके. सो प्लीज डू फॉलो इट, ओके. सो द मोर यू प्रैक्टिस द बेटर यू गिव इन, एंड एटलीस्ट 1 GT per day बोलते, but yes, it can be hectic also. So at least 1 GT in 2 days, do like this, okay. On day one you will give the test and try to finish it off at that day by the analysis or reading the explanations, etc. And it is the most important, GT देने से important is your sorry, giving sorry, reading the analysis, okay. Because you're not giving GT or you're not giving examination, you are preparing for the examination. And while giving GT or before giving GT grand test, think it like this way ki 3 hours of giving the test and 3 hours of reading the theory, etc. analysis. In 6 hours you are revising the top most 300 topics for the INICET, okay. Obviously important topics में से ही questions होंगे, okay. So this is very very important. Please do give grand test, at least one grand test in 2 days at least, okay. And on an academy application we have everything that you need, okay. The mini test, the grand test, the image based questions, everything is available, so you can use a app. And mini test, like I've told you earlier, and analysis is very important, and speed, this is very important, because 200 questions you have to do in 180 minutes, okay. So you need to have a good speed, and speed can be improved only by doing the practice, okay. There is no other tarika, okay. Just if you do practice, then your speed will improve automatically, okay. So practice is very important. And sorry, I'm not well today. And don't get discouraged by your rank or less marks in the grand test, okay. I never had good marks in my any of my grand test, okay. So don't get discouraged by them, and focus. For me, the main focus is your first and the second year subjects, because your medicine, etc., surgery, etc., are or even ENT, like ENT or the orthopedics, the normal anatomy is covered in anatomy also of these structures, okay. So first second year subjects are very very important. If you have read them thoroughly, at least 50% of the paper directly or indirectly comes from these subjects. These include the anatomy, the physiotherapy, the biochemistry, and the pathology, pharmacology, microbiology, and I'll add one more, that is your PSM, okay. In subjects may you will have directly or indirectly 50% of the paper. So give importance to the first and second year subjects, very important. And aggressive, you have to be aggressive if you are giving exam, and if you want कि I should have any chances of having grabbing a seat, then at least out of 200, at least attempt 185 to 190 questions. 190 at least attempt one. Option B you have marked out, then you attempt, and 50-50 वाले two options वाले तो सारे करने ही करने attempt. Okay, so very very important. Sleep cycle adjust according to 9 a.m. examination timing, so at least 7 a.m. you need to be awake, sorry. And after, one more important thing, the documents, the exam center location, and your admit card or the hall ticket. Okay, छोटी छोटी चीजें हैं, just prepare them at the correct time. Okay, and don't change your strategy right now, I have already told you. And एग्जाम ग्रैंड टेस्ट देने के बाद डोंट बी एंशियस, बी ऑप्टिमिस्टिक बिकॉज यू नो इनफ. ओके, एंड एट दैट टाइम what is your thinking of the mind, या what is your attitude? अगर आप positive attitude के साथ if you'll give examination, then obviously you will score well. Okay, so this is very very important. To last 10 days में at least if you are preparing very sincerely, so you can do so like one day max to max for the Diwali. Okay, enjoy that, max to max one day. Rest days you need to study for at least 12 hours daily. Okay, so make a schedule according to it, and it's 12 hours means give 6 hours for the theory revision and 6 hours for the question practice, because question practice is also a revision and the best way to revise. Okay, so uh, prepare a timetable and keeping in mind the 9 a.m. examination time. Okay, grand test, images, we have mini test, we have discussed about these all clinically important topics. And now the volatile subjects जो you should revise, and very important high yielding volatile subjects that you should revise, like just 7 days or 10 days before the examination. Okay, these are obviously your anatomy. Okay, your microbiology, your pharmacology, sorry, these are your volatile subjects and the very very important ones also. Okay, so please do revise them at the last minute. These are very important subject. So many students cover them in set like anatomy, ortho, surgery in one go, then physiopatho medicine in one go. I had also read medicine like this only. First of all, I firstly start from the basic subjects. You have to cover them first. So firstly start, you should start with the anatomy. I'm telling you, if you are preparing from the beginning. Okay, so we'll discuss this sometime earlier. This is for the INICET 2021 only. So इसमें the volatile subjects जो हैं we have discussed. And now high yielding subjects. High yielding subjects means short subjects are very very high yielding, because if you revise entire medicine in like 3 days, okay, entire medicine in 3 days, so but you could revise the derma, anesthesia, radio, psychiatry, forensic, uh, even the ortho, and your ENT and opthal. So 1 2 3 4 5 6 7, whereas in max to max 4 to 5 days you can revise these 7 subjects instead of just one. Okay, and these are high yielding. At least 200 questions में से you will have at least 50 to 60 questions from these subjects. Okay, so very high yielding thing hoti hai, very smart study, that at the last time please do revise these short subjects. These are very important thing. Okay, so that was all about today's gyan about INICT. Just you have to remember, take care of your health. Okay, लास्ट डेज में बीमार नहीं होने का. ओके, एंड go with the positive attitude, and you all know ki it is not that difficult, it is crackable, competition will be less, questions will be easy, just a bit trickier as compared to the NEET PG, no doubt about that, but yes, very easy. सब पढ़ा हुआ होगा आपने, बस उस टाइम पे यू जस्ट नीड टू give paper with a positive mind and don't think any hi-fi. Okay, so all the best to everyone. Happy Diwali to all of you. Thanks for watching my lecture. If you liked my lecture, please like, share and subscribe, and you can subscribe for any of the subscription course for the NEET PG or any other competitive examination on the Unacademy, and use my code, that is Anshul B10, to get extra 10% off. Okay, so bye bye.